I got very excited when Jaime said I can talk about cultural competence in the DVM curriculum. And then I got very sad because he said I had 8 minutes and I thought I'd have about an hour. So I'm really sorry that I'm rushing through this. Happy to talk to anybody. And I've got some cheat notes so that I do try to keep it a little bit contained. For me, I guess, in embedding cultural competency aligned very nicely with a lot of stuff that's come out recently about the idea of graduating 21st century veterinarians with 21st century skills, and cultural competency being very key to that skill set. And so in 2015, the City School of Veterinary Science introduced a new professional program, the DVM program, and there was a commitment, I guess, across the board that cultural competency was going to be one of the core elements in that curriculum. Now, having buy-in is one thing, but actually seeing it play out is the challenge, and I think that's probably the challenge that the university is facing as well. And pertinent to that was what Pauline said about the ticking the box exercise. It's actually I think it's actually quite simple to tick the boxes and say that you've embedded some cultural competence into your curriculum. It's another thing to actually see that you're having an impact on the students that you're graduating, and I think that should be the end game for us. So the first step was to look at that alignment process between the veterinary curriculum and the cultural competency curriculum. And we did this by considering, I guess, where cultural competency sat within the profession, the relevance of it to veterinary science as a discipline, and then we also had to make sure that we aligned with, obviously, the university's framework, which has evolved as we've evolved our cultural competency curriculum to now actually have some graduate qualities that are specifically around that area. And when designing the learning activities, we wanted to start by developing an understanding of cultural competency fundamentals, and then build on the complexity and give it some context, give it some veterinary context. And so to truly embed cultural competency, we needed to include it in a range of units, because it's really difficult to do it as a standalone explicitly. Because you end up sort of making it like the little problem that you have to deal with and that the students just kind of have to get through. So I really think part of the process is to get buy-in across multiple units of study that work together to embed it. So the new DVM program has been introduced, as I said, at a time when there's actually veterinary education landscape is changing. And so that idea of 21st century vets being required to work in cross-cultural settings, and the fact that the number of international students that come into our degree is forever expanding. And we have a high number of students from North American schools and from Asia in particular. And it meant that we had a clear directive, not just from accrediting bodies that we rely on to give our degree its reputation, but also from the profession in general, both here and overseas, telling us that CC was a core important skill for a veterinarian. So to meet the challenge, we committed to explicitly embedding it, and it was good that somebody asked what's explicit and what's implicit, and I had to Google it while I was in the back just to make sure I was on track. And we have tried to do it explicitly. I would say, when I get to the end, one of the lessons learned is that sometimes you have to think about backing off and actually then looking at making sure you don't lose the implicit content that you've got, because I think you need the two together. So I like the idea of start off implicit and then get explicit, because it can be very confronting for students, and if you turn them off, they'll still pass the exam and they'll still get the cultural competence badge in their degree, but you won't necessarily have changed their habits and their actions. So we've actually got, as I said, clear directive that diversity and multicultural awareness is where the North Americans have sat it at, is actually an important skill that we need to develop in our graduates as far as the North American accrediting bodies are concerned. But it's really hard to sell something to students by saying, we have to teach it to you because the accreditation bodies said we have to teach it to you. And so we had to ask the question, why do vets need to learn about cultural competence? But lucky for us, I guess, that part was a bit of a no-brainer. And I think it'll be more of a challenge for some of the other science disciplines to actually ask that question. And so the fact that cultural competence touches on aspects of the veterinary profession in many ways in terms of communication with clients, providing a better understanding of cultural attitudes and the practices that inform animal care and allow a veterinarian to do the work that they do, and also recognising differences in gender attitudes and how they affect the work environment, and the fact that the veterinary profession has gone over the last 50 years from a profession that's predominantly male to a profession that's predominantly female, and that's really changed the work environment. And so there are lots of aspects of the veterinary curriculum and the veterinary profession that actually sit very nicely with cultural competency. I guess the challenge was that the DVM curriculum is very tightly packed. There's a lot of content, and we expect students to work at a very high level, but the idea of introducing more content was going to be a real challenge. And so we had to be very creative at looking at anything that we introduced, being able to align it directly, not just with the cultural competency learning outcome that we were trying to achieve, but with the overall unit of study learning outcomes in any particular unit of study, and then the overall graduate learning outcomes for our program. And I guess the final tier, which has come on board in the last year or so, is the university graduate qualities that underpin all of that. And the really nice thing is that across multiple units of study, and I don't expect you to read all of this, but trust me, the boxes actually fit in very nicely together. We could see very easily from starting off with that graduate quality of to work productively, collaboratively and openly in diverse groups across cultural boundaries, fits in very nicely with some of the graduate learning outcomes that we have for our DVE program, which fits in really nicely with, I've listed there some of the learning outcomes for the units of study that I teach in professional practice, and then fit in very nicely with those middle order learning outcomes that are specific for the subset of learning activities that we do that are part of cultural competence in that unit of study. And so we had 1 degree, 4 years. We've now embedded it in some shape or form in 5 units of study. And we deliver what I would say is over 46 hours of cultural competence. And by that I mean explicit. We haven't really mapped out the implicit learning, but certainly explicitly that's what we're looking at. And they're the 5 units of study, and I teach Vet 6101 and Vet 6201, the professional practice units. And it's really thinking about the idea that cultural competence doesn't require mastery of all the norms, values and practices of different cultures, but that you need to have students recognising their biases, being conscious of cultural dynamics, and having that willingness to adapt. And that's really what we're trying to teach our veterinarians, to be adaptive and resilient in the workforce. And what we've tried to do is take them along that journey of complexity, where we start off with the fundamentals, and then we look at how the impact of cultures and belief systems and perception of animals influence veterinary practice. We look at how effective communication plays a role in the ability to be able to engage with stakeholders, and then we carry it through to policy, protocol, and governance within the whole area of animal welfare and health, and then trying to get students to think about how they can apply some of those values and principles and behaviours that we talk about. And the idea is to do that across the 4-year program rather than to think you can cover that all in 1 year. So I would say also in terms of when you're looking at assessment tasks, I think it's actually okay to have those lower order assessment tasks, but because part of it is about teaching them the language and some of those fundamentals, and assessing those in a simple lower order assessment question I think is not a problem at all, rather than thinking that you jump straight to that synthesis and processing and application type question that may take time to develop. Because the other thing that underpins everything that we've done in cultural competence is creating that model of cultural competence being a continuum. And they've got to start somewhere. They don't start at 0. They probably start at -3, which is potentially cultural destructiveness. I don't think any of our students are at that level, thank goodness, although I don't see what they put on Instagram, so maybe some of them are. However, where we're trying to get them in first year is to make them culturally aware. And I think that's actually a tall order. And I think if we can do that in our curriculums, we've actually done really well. And I would suggest that maybe they could achieve the graduate quality by not necessarily being fully culturally competent or culturally proficient. I think somewhere in that cultural awareness, cultural knowledge space is probably where we would hope the majority, if not all our students get to. And if we can tick that box, then I think we can tick the graduate quality box. But maybe that's not appropriate for me to say. And so I want to give you the example of what we've done with it, what I've done with it in my professional practice units, and in particular the aspect that deals with effective communication, clinical communication. So this is the idea of how you communicate with a stakeholder, whether they be the owner of a dog, or whether they be a farmer on a cattle station, or whether they be a government body and negotiating disease outbreak. And so the first step really to define the context for the students so they kind of understand where we're coming from. And part of that defining the context is to introduce the idea of stereotypes, of unconscious biases, of prejudices and judgment. And doing that I think is a challenge because students are they're really smart. The students that we get into the Faculty of Science are very smart, and so they can see it, they can identify it, but it's very difficult for them to actually turn the mirror on themselves and see the role that they contribute and that they play. And that was made very clear to me when I've read some of the feedback that I've recently, I haven't actually shared it with you, Jaime, the feedback that I've recently received from some students, but I'll share that with you at the end. So defining the context is really important, and then creating that link. And this is the bit that if you don't get this right, I think you lose the students. So for us, from the perspective of the veterinary profession, the fact that the behaviours, attitude, knowledge and policy all contribute to positive outcomes for practitioners, for the clients, and most importantly for the patients. And as I said, the patient might be a herd of cattle, but it is your patient nonetheless. And so for them to get the fact that cultural competence is what stands between them and being able to effectively work as a veterinarian, then as I said, it's a no-brainer for them. You get that buy-in. And then by giving them that context, creating a link and introducing some tools, getting them to actually adapt some of the tools that they've learnt in a non-cultural competence context into the cultural competence. So when I do effective communication with them, there is some cultural competence that's implicit there, because we talk about active and reflective listening, we talk about empathy, we talk about open lines of questioning and how to funnel in to get a really good history. We talk about non-verbal communication and proxemics and body language. We do all of that, but now we also do it in an explicit cultural competence context and allow them to appreciate that those tools, those generic tools that we've taught them, they can actually use in that cultural competence context. And then we unpack some strategies and introduce them to things that are more specific to cultural competency. So we talk to them about the SCORE communication principles and give them examples of how that may play out in a veterinary context. And then obviously the final thing is we assess the learning. In terms of the learning activities that we do, they are quite broad, and as I said, it's a lot of teaching hours, and we really start on day one, or week one I should say. So part of their orientation program and the first unit of study that I teach in the DVM is the Centennial Parklands field trip, and that comprises 4 workstations where they get introduced to the concept of One Health and the role of veterinarians in society. And one of those stations is completely dedicated to cultural competency, and I've had the help of Jaime to actually develop the learning activity around that and run it. We use obviously lecture discussions and presentations, a range of video resources. There are a lot of activities that involve reflection and small group discussions. We utilise some of the recordings that Jaime has developed to use within our classes. They work through a number of case studies that we deliver as a co-teaching activity, and we have a lot of guest presenters, because what we have done is really broaden the scope of cultural competence, and I think that's the other reason why we've gotten some buy-in from the students. So for them, cultural competence is not just about dealing with Indigenous communities, whether it's here or overseas, but it's also about dealing with urban cultures that they may not have actually considered are true cultures within themselves. So they get introduced to the idea of deaf awareness training. We talk to them about various social groups that they will need to interact with that have their own cultural norms, and they need to have a respect and understanding for that. And then in terms of assessment, there are formative assessments that they can do, and these are usually where they'll get some feedback, and there's quizzes and there's online questions. But we also have an explicit cultural competence question in every exam that's in the two units of study that I teach. The line of questioning, as I said, is not just that higher order thinking. Some of it is, do they remember or do they understand that model of cultural competence continuum that we've taught them? But then how can they apply their understanding of biases to a clinical situation and how it might play out? So there is certainly a range of complexity in terms of the sort of assessment questions that they get asked. And in terms of lessons learnt, I guess certainly the student feedback has really informed us, and that's part of the reason why I think there needs to be explicit embedding, because if you don't think it's important as an educator, there's no way the students are going to think it's important. But there's also an element of implicit embedding that needs to be there, because it has to be not an added on, it's got to be part of their learning, and I think that's why you need to have that implicit component. The feedback also, even though it makes me cringe, some of the feedback, and in particular the negative feedback, it actually reinforces to me how important it is to actually embed cultural competency into our graduates. So to give you an example, and this is the first external audience that I've said this to, the most recent feedback, we have somebody from the Chinese Confucius Centre come to talk to us about some of the cultural etiquette of the Chinese community. And it's a fun, fairly light, nothing heavy, nothing political. And during the talk she says, to the class, and I'm sitting in the class, so, can anybody give me an example of a cultural norm or a stereotype that people have of Chinese people? Deathly silence. Sana, in her usual enthusiastic way, I'm just another student in the crowd, I can say something. So I put my hand up and I said, well, most people think that Chinese people are really bad drivers. And it seemed that was fine. A few people giggled, it was all okay. This was me saying, guess what, guys, I'm teaching you about cultural competence, but I've got biases and prejudices just like you, because I'm just a human being, but I'm trying to make myself aware of them, and I'm going to share one with you. And I think for the majority of students that probably was the case, and they kind of got that. But certainly for a couple that gave me some very negative feedback, I'm a very racist lecturer. But it highlighted to me, one, the inadvertent impact that we have on our students through our behaviour, not just through what we're teaching them. And it also highlighted to me that they've still got a lot of learning to do. And unpacking racism and cultural awareness is not an easy task, as you said. So although it really hurt my feelings, it actually gave me a lot of drive and motivation to keep trying to give our students a learning experience that will actually mean they attain that graduate quality when they graduate. I think I better stop. Thank you.